Acharya Ragadirogan Satatanushaktan Asheshakaya Prasrutan Asheshan Avsukyamoha Jakhana Yo Purva Vaidyaya Namostu Tasmai. Again, namaskaram to all. So, actually, even though we started as a Swadhyayam on Nidanam, incidentally, we moved into such a direction wherein we are started discussing the clinical methods in Ayurveda, which is good. I think it is essential also because there is a very strong opinion evolving over years that there is no effective method in Ayurveda for a proper clinical practice. So that is why the students, teachers, practitioners, everybody slowly switched over to the Western way of clinical medicine or clinical methodology, I should correctly say. So good that we are slowly switching over to that direction. As a clinician, personally, I am following a method which I think as Ayurvedic. And over years, I have tried to avoid the influence of allopathic or Western clinical methodology to the best level possible. Of course, I don't think that it is something like a extremism where a person is becoming resistant to some sort of a knowledge. It is not like that. But definitely sticking on to some foundation of a school is very important. Okay. Now, we were discussing about the importance of Nidanam, knowing Nidanam properly. And we have seen in Sarvaroga Nidanam that Nimitta Hetu Ayadana Pratyayothana Karanaihi Nidanamahu Paryayihi. So it is the complete understanding of all those factors which is triggering a samprapti on. That is what we look into when we say the word Nidanam. In real clinical practice, what are the things which we look for? That is very important. Ayurvedic clinics is somewhat very easy, but at the same time, very precise. Precision is the buzzword as far as Ayurvedic practice is concerned, which actually we are losing. So, Nimitta Hetu Ayadana Pratyayokthana Karanaihi Nidanamahu Paryayahi. Each word which is used here as a synonym, Paryayam of Nidanam reflects different shades of meaning of that idea, Nidanam. But I'm not going to such finer aspects of theory because I'm very sure that, okay, everyone is looking for enhancing their clinical capacity, not to go to the details of the literary beauty or literary aspects of the Shastra. Of course, it is very important. So, what do we look at while we discuss Nidanam? That is an important point. See, it is very easy. Broadly, they are classified into three categories. Everyone knows, isn't it? Broadly. Of course, there are subcategories. But interestingly, this threefold broad classification of all Nidanas Actually, that is all encompassing. Nothing is left behind. That is the beauty of it. What is that threefold classification? It is about kala, artha, and karma. If you sit comfortably in one place and relax, and then start looking at all the possible nidana factors, all possible nidana factors, then we can understand that nothing goes beyond this threefold classification: kala, artha, and karma. Interestingly, kala and artha and karma, these three are the nidana for arogya as well. So when the same X is causing arogya, the same X is causing roga, I think there should be some trick behind it. That trick is the most important part. What is that trick? It is about the way in which a particular person, whether his sharira, manas as a whole, whether it is the purusha as a blanket term, whatever it is, how the individual is engaging with these three factors. So it is about the engagement. So that is a very beautiful and very precise understanding of all the possible engagements that a living person can have in his daily life. Kalam, artham, and karmam. And the types of engagements are again divided into four. The four types of engagements that a person can have with the three principles or factors. That is what we are looking for. The fourfold engagements are: number one, samyag. Samyag. Samyag means proper, optimal, the way in which it is supposed to be, ideally. Samyag. Which is the reason? That type of engagement is the reason for arogyam. Fine. Then there are three possibilities for rogam, three types of engagements with the three factors, kalam, artham, and karma. They are hina yogam, ati yogam, and mithya yogam. Everyone knows these things, but we have to look into the practicality. Hina yogam means there is minimal or less or no engagement at all with the kalam, artham, and karma. This is very beautifully elaborated. Sahinaha, hina shidadi. As far as kalam is concerned, sahinaha, hina shidadi. Adiyogaha, adilakshanaha. Mithya yogastu nirdishto viparida swalakshanaha. So hina yoga means, suppose this is the monsoon. Okay, monsoon. Yesterday only, or day before yesterday, I think, the report came. Okay, the country is going to face serious issues because of a dip in the monsoon level. The entire August, the month of August, had very little monsoon. So there will be a scarcity. So that is actually a hina yoga. And the country is going to face various problems. What are the various problems? The various problems are not just about the problems that is going to be pratyaksha, in pratyaksha, it is going to reflect in various factors like, okay, agriculture is going to be affected. The availability of drinking water is going to be affected. So many things, pratyaksha. Paroksha, it is going to influence the health status. It is going to influence the disease pattern that is supposed to happen. So, a Hina Yoga of Kala, Varsha. Kala is here in this particular context in the form of Varsha. Ushnam, Shidam and Varsham. These are the major criterion on which we are understanding the influence of Kalam. So here it is Varsham. Then the other, okay, September compensated it. Okay, there is a little bit of relief. September, the month of September compensated it. Actually, it was supposed, or it was calculated that there is a 50% deficiency in, by the end of August, it was 50% deficiency, deprival of the expected or the average rainfall that the country used to get on an average. But it was 50% less. Than September, unexpectedly, the fourth month of monsoon, get some, we got some extra rains. And so that 50% decline got reduced to 38%. So some 12% is compensated. Good. So these are just news which we pass through in the newspapers or in the TVs. But it is not like that. It is not just, who cares? Who cares? But it is not like that. You may be knowing that last year, very interesting developments happened. One case, actually, it need not be the first case or the one case, one case that might have happened all across the globe. Last year, there was an official diagnosis as a disease caused by climate change. So the official diagnosis of that disease was something XYZ caused by climate change or global warming. So this is how the kalam is going to influence. And this kalam, in Ayurveda, the understanding about kalam is as a Nidana Khadaga and in general is very broad and beautiful. Kshanadir Vyadhyavastha cha kalaha. Kshanadihi Vyadhyavastha cha. So here Vyadhyavastha Rupa Kalam is not relevant in our present context, because this is the way in which the body is getting engaged with the time concept or the time principle. So Kshanadi, which starts from the Kshana to the, at least in a practical sense, that Divasam, then Paksham, then Masam, Ritu, Ayanam, Varsham, at least to that level. So the engagement of, and primarily it is revolving around the concept of Ritucharya. So Ritucharya Vyadikramaha. Ritucharya Vyatikramaha. At one point, what is Ritucharya in the context of Nidana? Ritucharya tu Shitoshna Vrishti Dosha Pratikriya. Ritucharya tu Shitoshna Vrishti Dosha Pratikriya. Ritucharya tu Shita Ushna Vrishti Dosha. Shita Dosham. Shida dosham, here the dosham is not the tridosha, but the dosham is the bad impact. So the pratikriya done for the bad impacts of Shitam, Ushnam and Vrishti is broadly known as Ritucharya. And when this Ritucharya is not followed, that itself is a sufficient reason for a big list of vyadhis. And kalajam, okay, they are known as kalajam. So when the engagement of a living body of a person with kalam is not samyak, and that not samyak is asamyak, and that asamyak can be of three forms: hinam, ati, and mithya. Ati means ativrishti. We are seeing that one also in certain areas where it is not supposed to rain at all, that is facing floods, that is atiyogaha. And it is predicted that the coming year is going to be the hottest year in the last 100 years or so and so. So that means adiyogam of the ushnam, grishmartu, or whatever, temperature in general, ushnam. Then mithyayogaha. Mithyayogaha means viparita swalakshanaha. Mithyayogastu nirdishtaha viparita swalakshanaha. Swalakshana vaiparityam is called mithyayogam. What is swalakshana vaiparityam? It is supposed to be varshartu, but in effect, anubhavam, in effect, it seems like grishmartu. All the characteristics are suggestive of the presence of grishmartu or hemandartu. So viparita swalakshanaha, viparyayaha, kala viparyayaha, that is known as mithyayogam. In any case, whether you understand the concepts of Ritu Viparyayam or Kala Viparyayam explained in our textbooks in a very beautiful way, whether you understand it or not, this is going to be a towering presence in the human life. It has already become a towering presence, and it is going to be more evident in the years to come. So while discussing or while considering this kalam, it gains lot of importance as a nidana factor. The way in which the agantu jwaras are happening, all agantu vyadhis are happening, especially the type of agantu jwaras specifically, that has changed significantly in tune with the kala viparyayam or the changes in the kala. Need not be viparyayam always. Sometimes it is delayed, sometimes in excess, whatever the case may be. So it is going to be a matter of serious consideration, not just a casual or a passing show, but it is going to be a serious consideration in as a nidana khadaga in the days to come. So that is kalam. Then what is artham? Artham. Artham is about the engagement of the person with the sensory objects around. So that is the engagement that the human body is having in some sort of the way in which the sensory instrumentation of a person is going to get engaged with the sensory objects outside. That is also very important. We do not understand what we are talking about or what we have learned about. These are going to be very important, not as just as nidana ghadagas, but as in many other contexts as well. Because ultimately, the connection between the individual and his or her environment, the engagement between the person and the living environment, that is fundamentally through the sensory instrumentation. The 5 jnanendriyas, they are going to be the most critical ones. So here also the 5 indriyas, 5 indriyarthas and fourfold engagement. Samyag Indriyartha Samyogaha, or yes, Indriyartha Samyogaha. That is the foundation on which health is built. Then the other three, Hina, Ati, Mithya. Hina, Ati, Mithya. Hinaha arthena indriyasya alpaha samyogaha svena naivava. What is hina indriyartha samyogaha? Hinaha arthena svena arthena alpaha samyogaha na samyogaha eva. Either minimal, less, suboptimal engagement with an indriya and its indriyartha, or no engagement at all. No engagement at all. That is the other possibility. So these are going to create lot of health issues. These are sufficient reasons for making the doshas vikritam, vruddham or kshinam. In the vruddham itself, sanchitam or prakupitam. So what is the what are the examples? See, say take the example of our ears, Shrotrendriyam. So when there is no engagement or minimal engagement, that means ears are not getting exposed to sound at all, or ears are getting exposed to very minimal sound. In due course, that is creating some sort of a vikriti or imbalance in the way in which our whole sensory instrumentation is operating. This Hina Yogam is a very interesting character, because we will not even understand at times that this is happening. Whereas the Mithya Yogam and Adi Yogam will be grabbing attention very fast. But the Hina Yogam is not like that. We will not understand that, okay, we are not listening to something, or we are not exposed to this particular Indriyartha at all, or we are getting exposed to that Indriyartha in a very suboptimal level only. We will not understand. But slowly that is going to create Indriya Pradoshaja Vyadhis. And Indriya Pradoshaja Vyadhis then in a paroksha form is going to influence the way in which the manas is operating in such a way that our understanding about that understanding is a sort of avabodham. That is what we call these days as an umbrella term called cognition. Okay, so it is going to influence our cognitive capacity, which we are not understanding actually, which we were left unnoticed. So a suboptimal engagement of Shrotrendriya with its Indriyartha, that means Shabda, slowly start influencing the Manas, then our Bodham or Avabodham or Pratnya even to some extent, and then it is also going to influence the Srotas inside, the Sapnyavaha Srotas. We do not get these ideas. It is more evident. Sometimes there is a word in Ayurveda, in Netra Chikitsa, especially there is a very interesting word called lazy eye. It is a lazy eye. What is a lazy eye? Lazy eye is a condition developed by the suboptimal use of one netrendriya. One netra is not getting exposed to its indriyartha, or getting exposed to that Indriyartha in a suboptimal level. So what happens? Slowly, in due course of time, that Indriya is becoming lazy. Its capacity to perceive that Artha is getting lost slowly. In the case of eye, it is very evident. That is why there is a term called lazy eye. But at the same time, there is no popular terms like a lazy ear or a lazy nose. But it is there. In reality, it is there. It is a possibility. It can happen when particular Indriya is suboptimally exposed or not exposed to Indriyartha for a long time continuously. It is going to become a lazy Indriya, Hina Yoga. So that should be looked into while we are searching for Nidanas. That is going to influence the way in which Pranavayu is operating, Manas is operating, Sapnyavah Srodas is operating, and overall this is going to influence the cognitive whole of the individual. The complete area of his avabodham, awareness, is going to be affected. That is the hina artham. Adi artha indriyam, adi indriyartha samyogam. I think that we do not even understand that such a thing exists, because practically we are all living in such an environment. Everything is in excess. We say that, okay, there is a funny word these days. What is that word? Screen time. Screen time. Screen time has become a standard terminology while listing out the Nidanas. Increased screen time, late night screen time. What is the screen time? The amount of time that the eyes are getting exposed to a bright screen, like as we are doing right now. Right away, we are doing the same thing. To a bright screen. And longer the time, the higher the chance of Indriya Pradoshaja Vyadhis. Again, regarding the Shabda, Ghrana, Rasa, Sparsha, all Indriyas are at the risk of getting exposed to Indriya Artha in a Ati way, Ati manner, creating lot of Vyadhis. All these things. Adiyogaha, Adisamsargaha, Mithyayogaha, Sukshma Bhasura Bhairavam, Atyasanna Adidurastham, Vipriyam, Vikridadicha, Yadakshna Vikshyate Rupam, Mithyayogaha Sadarunaha. That is the way in which Mithyayogam of eye is explained. So, Vipriyam, Vikritam, Atyasannam, Adiduram, Sukshma Bhasura Bhairavam. So this screen is a Sukshma Bhasura Bhairavam. Reading a long PDF on a small phone screen, which is not a rare event, which has become the norm, the standard in the post-COVID time. Beforehand, I think there were some restrictions, but it has become the norm these days. Even the teachers are sending their notes to even the small kids in the KG classes. Even they are sending some assignments and everything in WhatsApp. And they are opening it and they are spending most of the time in front of the screen. So, Sukshma Bhasura Bhairavam, sitting in front of this horror thrillers or serials, need not be very horror thrillers by default. Watching the serials, Atya, that Vipriyam Vigridadicha Yadakshna Vikshyate Rupam Mithyayogas Sadarunaha. So these are the impact of this Mithya Indriyartha Sannigarsham is not limited to the Indriya alone, like the case of Hina and Adi. In due course, it is going to influence the way in which the Buddhi is operating. because it is influencing the manas, and manas is supposed to be the tool of the buddhi, in which the buddhi is getting operated. And when your manas is influencing, the way in which you are addressing a problem, a situation, is all going to be affected. So when you find somebody seeking help for the behavioral aberrations, behavioral problems, hyperactive disorder, sleeplessness, many n number of issues we are facing these days, to such an extent that at one point of time, these will be considered as the normal. So somebody who is not behaving like this will be considered as abnormal. That is the way in which things are changing. So that Hina, Ati and Mithya Yoga of the Indriya with the Indriyartha is not going to be limited or restricted to some Indriya Pradoshaja Vyadhis, but they are going to create broader influence on the Manovyapara in Pratyaksha and in Paroksha. Manasharirayostabaha parasparam abhivrajed adharadheya bhavena taptajya ghadayoriva. So in Paroksha, in due course of time, this Indriya Pradoshaja Vikaras are going to manifest as Kaya Vikara, Shalya Vikara, Shalakya Vikara, Bhuda Vikara, all these things. So that Indriyartha. Then comes the Karma, Karmam. So the Hina Yoga, Adi Yoga and Mithya Yoga of Karma causing Vikara, and Samyag Yoga of Karma causing Swasthya. That is also a big topic where we discuss with the Prajnaparadham. This Prajnaparadham alone is considered as the exclusive marketing agency of all Vikaras, all Vyadhis. That we will see in our next session. So with this we conclude. We were discussing about Kala, Artha, Karma as the base classification of all possible Nidanas, and about their Samyaga, Hina, Ati, Mithya Yoga. And we are spreading into a very broad canvas of understanding Nidana in practical clinical methods. So about the karma, we will discuss in our next session. So we conclude. Bhishajam sadhu vrittanam bhadram magamashalinam abhyasta karmanam bhadram bhadrabhilashinam.